we need to think about both how to react to what's happening in Washington and what our proactive steps should be. So Donald Trump and his friends, Paul Ryan and Mitch McConnell, are doing everything they can to undermine and sometimes to repeal Obamacare. We've got to fight them tooth and nail. Bruce Rauner's been invisible on this. Invisible. Like, as once again, governors of both parties have spoken out loudly and clearly and strongly against this insane push coming from Washington. We need to push Governor Rauner to tell the truth, to speak up, because if he speaks up, that will help as we're trying to make sure that Republican members of Congress from Illinois do the right thing on health care. If we, God forbid, fail to stop them from doing what they've been trying to do, we'll have to fill in the breach. We'll have to pay for the Medicaid expansion here in the state of Illinois, as well as the tax credits on the exchange. If we want to do that, we have to have a fair tax code. We can't do that with the tax system and budget that we currently have in Illinois. That's why progressive taxation is so important. But let us all acknowledge that none of that is enough. As important as everything we're talking about now is, it's not enough. And this is one of the biggest distinctions in this campaign. We need single-payer health care. And we need single-payer health care in Illinois. There are people running in this campaign who will say, yeah, single-payer is a good idea for the federal government, but we shouldn't do it in Illinois. I say the opposite. If we're going to see the federal government take on that kind of bold idea, they are going to need to see a state do it first. That's how Obamacare passed in the first place. And so in Illinois, we ought to be moving towards single-payer health care. We're a large enough state and a prosperous enough state that it's something that's doable, but it's not doable with our budget the way it is now. And that's why bold reforms to our tax code that allow us to have adequate revenue without punishing the middle class and the working poor are so essential. Because when we close our eyes and picture a 50 or 80 years from now healthcare situation where the country has single payer, that will have happened because we here in Illinois will have been bold and led the way. And we need a governor who has the commitment to do that, and who understands the reforms to our tax code needed to make that a real possibility.